Business sector has launched an urgent plea for the final stage of the NHI Bill to be put on hold. The sector has written to the National Council of Provinces and the Deputy President, Paul Mashatile, in his capacity as leader of government business on their request. We speak now to Dr. Nicholas Crisp, Deputy Director General of National Health. Dr. Crisp, always good to see you. Thank you very much for your time this afternoon. Perhaps let's revisit this moment when the President was opening the Dr. Pixley Aseme, not doctor, but Pixley Aseme hospital in KZN last week. This is what he said.
So sesifikile ku NHI, National Health Insurance. And uma ubuka yonke into ela kulesibhedlela, then you see the future of healthcare in South Africa.
Dr. Crisp, the National Council of Provinces is expected to vote this week on the NHI Bill. It will then go to the President. And here you have the President saying pretty much it's a done deal, is it?
Yeah, thanks very much to Desiree, and nice to be with you and to speak to your viewers. So my understanding is tomorrow is the debate in the National Council of Provinces, where the provincial mandates were finalized this morning in the Select Committee of the National Council of Provinces. Last week and the week before, we got the mandates from 8 provinces, and the Western Cape was granted additional time by the National Council of Provinces to have further consultations and to formulate their voting mandates. So we now have heard from all 9 provinces in the Select Committee, and 8 have indicated their intentions to vote in favor of the bill, and 1 has voted in their intentions to vote against the bill. So that will happen tomorrow in the National Council of Provinces with a debate, and we will see what comes out from there. Once a bill is then passed by both houses of Parliament, it still needs to be assented to by the President. The President does not always assent to everything that comes from Parliament and may refer matters back. That's a normal process that happens from time to time. But once the President has assented, then in terms of the provisions of this bill, the President may then promulgate the clauses of the bill, or they will become sections of the Act, on different dates. And that is necessary because this is the implementation of something new, so different provisions of the Act will need to be brought into effect at different times to enable us to create the necessary institutional capacity and implement the long road to the reforms of the health system.
You speak of the long road to the reforms of the health system, so please do assist. But in my simple understanding, you've got 3 major role players. So you've got the medical aides, you've got doctors, and you've got South Africans. The medical aides have shown resistance. Doctors, some of them, you speak to them, have shown resistance. They are not against the what, but they are against the how. And then, to your knowledge, what are South Africans telling you? What is the understanding? Is there an understanding of NHI and how it's going to be impacting the person on the ground's life?
So, Dudu, there are many more stakeholders than the 3 that you've mentioned. There are, in the public sector, other government departments who will be impacted, including the Education Department that we work very closely with, Social Development, and of course, there will be impacts in the Department of Public Service and Administration, and we work with Treasury, provinces, etc., etc. So in the public sector, there are many stakeholders. There are also stakeholders in the regulators and other public entities that also have something to say about this. And then in the private sector, there are many different facets of the private sector. There are those that run medical schemes, and those are not for profit. They're supposed to be for the benefit of the members, but nonetheless they have administrations and staff who obviously would not like to see their employment changed. There are medical schemes administrators because of the complex environment. Those are for profit. Some of them are on the stock exchange, very much motivated by making money rather than specifically doing something to improve healthcare. There are providers of the various products medicines, medical devices, various consumables, and so forth. And then there's the most important stakeholders, and that's the you and me and the public, 62 million people who are all basically unhappy with the healthcare that they get. We hear complaints from every quarter, whether they receive their healthcare from the public sector or from the private sector. People have got a hell of a lot to say about the poor healthcare that they get, or the cost of the healthcare, or some other complaints about what we do for them as health practitioners. So to answer your question, the public, the general public, have told us repeatedly that they do not like the current health system. And that's not just public sector patients who have no option because of their social status and their financial status to use the public sector. It includes a wide range of people who just can no longer hold on at the costs of trying to purchase their healthcare in the private space. The vast majority of South Africans are asking us to reform. Yes, we know that there are people who have business models and who have various arrangements and privilege within the current system who are vehemently opposed to the reforms or aspects of the reforms. Our interactions with many of them show us that they haven't all read the bill. They rely on other commentators to tell them what's going on, and that's great pity, because the bill is quite rich with reforms and things that will unfold over time to improve the health system. They also, sorry, just last comment, is that people don't seem to realize that the National Health Act remains in place, and this is augmenting the contents of the National Health Act. So I would really encourage people to go to source. They can go to our websites and have a look, get the original documents and be informed.
Okay. Dr. Crisp, while that definitely needs to happen because you must interrogate it for yourself as a South African to understand it better, but perhaps let's play out a scenario. It's the day after the president has assented the bill, and Bonisile Mvubu has her ID card and she needs medical assistance. Or maybe not the day after the president assents it, but now we are on the day where it is law. Now we are in full NHI mode. Bonisile Mvubu has her ID. What happens? She needs medical assistance.
Well, so if you've read the bill, Section 57 will explain to you that it's going to take some time to set up the administrative structure. So there's not anything that's dramatic going to change on the first day. There's a whole lot of strengthening of the public system that has already been underway for some time and continues. And my colleagues who work in the other branches of the health departments have been very busy with the hospital branch, the primary health care and district health services branch, and so on. So it depends on your patient that needs the health care on where they find themselves. So if you find yourself in some rural village in Limpopo or Eastern Cape, you will continue to go to the clinic. We are busy, and my colleagues are working very hard to get the ideal clinic status in all of those clinics. It's a process that has improved dramatically over the last years, but it's not everywhere yet. If you are a privileged person who lives in Hyde Park or Rosebank and has a medical scheme, you'll continue to go to your current provider and you will have your healthcare paid through whatever package you've insured yourself for. So in the initial phases of the transition, the system will continue while we fine-tune. In the private sector, what we will do, working with the Competition Commission and the Council for Medical Schemes, we will begin to regulate prices, which is a long overdue aspect of that healthcare. So there are many, many steps that are outlined either directly in the bill or enumerated in our website.
So safe to say, Doc, it could be many, many years before it becomes a reality. But while that is in the works, what then do you say to South Africans who are not insured, number one, who rely on public facilities that are not where they need to be? I need not bore you with the detail because you know exactly what some people are faced with. What do you tell those South Africans while we are in the many years in the making of not just NHI, but of fixing problems that plague people where they have to wake up at 3 a.m. or the thought of going to a public hospital, you're like, I'd rather take my chances with whatever home remedies there are, right? So what do you say to those people who are quite desperate for help now?
Yeah, well, clearly that's why I came back into the public service, because I find that that is unacceptable, and there's lots of room for improvement. And in fact, we have seen quite a lot of improvement, although it's not everywhere. So there are undoubtedly facilities that we should all be embarrassed about, and the provincial administrations who run those public facilities are all working quite hard to make sure that they do improve the services. So, I mean, all we would say is that report any bad quality, bad service delivery, and we are acting on what we are picking up. You can't wave a magic wand and suddenly the whole country's problems are fixed. That is unrealistic to have that kind of expectation. But what we can say is if we don't put the framework in place that allows us to make those changes, it won't change. And what people are focusing on is Section 33, because that's where the business sector is making noise. But in fact, Section 32 and other clauses that deal with the reforms of hospitals are as important and will come earlier in the sequencing of improving the health system, including the sections on district health management and on the rollout of primary health care through contracting units for primary health care. So, I think we must be cautious, first of all, of overpromising, but we must also be cautious of thinking that just because somebody doesn't like one clause, the whole rest of the bill is not acceptable and it's going to be bad news for the public. It won't be. It will be systematically better for everybody.
Doc, you also hear when some sectors of society make a case, they will quote what is happening not only in some parts of the continent, but the United Kingdom, for instance, with their healthcare system and the problems that are there. Are we comparing apples and apples?
No, not at all. I mean, I've been privileged to work in 7 countries, and I have traveled to more than 20 and looked at the health systems of all of them, and there's not one that doesn't have trouble. And their troubles and what they deal with in their health systems are all for different reasons. I recently came back from Denmark, which has a quite remarkable health system, but people still complain about aspects of it. They do pay 55% tax, 25% VAT, and a range of other taxes, for which they ostensibly get free health care. But it does not cover any dental work or physiotherapy. They still pay in for various things. But they have, if you go into their facilities, beautiful services. But what they don't tell you on the surface, and you have to go there to find out, is that the government regulates who may practice where, how many practitioners may be qualified every year, where they may practice, what they may do. Everything is regulated, and that's how national health insurances work if you want to control the costs. So they've also regulated that their private sector can't be more than 6% of the service delivery costs. So I think every country will have its own uniqueness. We've spoken to Indonesia recently, to Japan. We do talk to the colleagues in the UK. So we do understand some of the reasons why their various systems have the problems that they have. They're very different from ours. We have a unique problem with inequity. It's been entrenched over 300 years, and it's got worse, not better. And it's time in the healthcare sector that we sort it out and that we really implement what we say in our Constitution, that we are all respected as human beings and we all have a right to healthcare when we need it.
Doc, please do forgive me. I'm just curious. Do you use public healthcare?
So I have from time to time, and I used to use it more regularly than I do now. I do have a hospital plan, the very lowest possible hospital plan you can get. So a lot of my healthcare I get outside of, obviously I'm a doctor, so I will not need to go for healthcare as often as other people would. But yeah, so I do use both public and the private delivery system. But in terms of paying, whether I go to a public or private healthcare sector, I'll have to pay the same amount because of what I earn. Okay.
Doc, thank you so much for your contribution and helping us understand this afternoon. Dr. Nicholas Crisp is the Deputy Director General of National Health.